Osun Health was in the doldrums when Aregbesola mounted the saddle of administration in 2010. A strike action was ongoing, so the hospitals and health facilities, which themselves were begging for attention from dilapidation, were ghost towns. To assuage the grievances of the workforce, the government, working through Dr. Tope Ilori, the then Commissioner for Health, held meetings with the concerned unions and the leadership of the state health system. An understanding was reached with the governor leading the executive to sign the agreement in a ceremony witnessed by the press. Things did not remain the same throughout Aregbesola's tenure because government swung into action immediately, working with a 6-point integral action plan, one of which was the restoration of healthy living.
As part of 6-point integral action plan, he said restoration of healthy living. And so far so good, we have done that to a large extent, sensitizing our people for them to live a healthy life, the work to live, the innovation of our hospitals, motivation of workers, purchase of equipment. We have outsourced our pharmacy. So if you go to our hospitals now, some drugs are still free, while others you have to pay for it, but at a lower price than what you will get in the community. In 2014, we bought 100 handheld scanners for our pregnant women in the rural area, so that when a pregnant woman goes to any of our facility, a midwife will just quickly scan the mom. If there's any need for that particular patient to be referred to tertiary or secondary center, they quickly refer them. Same 2014, we bought 4 3D Doppler scanners, which we gave to one of the 3 senatorial districts, Iwo, Ilesha, and Osogbo. The 4th one was given to Lautech. Our health insurance agency has just recently been established, because we know that we want to be compliant with universal health coverage so that we reduce out-of-pocket expenditure on health for our people. 2 weeks ago, I was in Germany to finalize the issue of cancer screening program for our state.
In the Osun Health program, prevention took the front seat. This was the reason why the Ministries of Health, Environment, Women and Children Affairs, Social Engagement, Youth Sports and Special Needs, and the Office of Her Excellency, the wife of the governor, worked in synergy to provide excellent health coverage for the residents and visitors in Osun. Within the new Aregbe dispensation, the Ministry of Health touched the lives of the people through its multiple arms like an octopus. First, it discharged its services across the state through 57 health facilities controlled by the Hospitals Management Board. The Hospitals Management Board administers 9 state hospitals, 6 general hospitals, and 42 comprehensive health centers, not counting the numerous primary health care centers managed by the local governments. There was an agency called OSACA that took care of issues relating to HIV and AIDS and its management in the state. O-Ambulance was another arm of the Ministry of Health that ensured prompt reaction to emergency cases like motor accidents and other life-threatening matters in the home or on the roads within the state. The ambulances respond through designated numbers known by everyone in the state to save lives.
In 2013, we bought 50 ambulances put on the road, to save lives. In 2016, 1,774 lives were saved. In 2017, 630 lives were saved. Within 10 minutes, you call our ambulance, they respond to you because there's no local government where we do not have this ambulance. Basically, the ambulance is not to carry dead people. The ambulance is to respond to emergencies.
Tertiary health facilities like Lautech Teaching Hospital in Osogbo and Obafemi Awolowo University Teaching Hospital in Ile-Ife provided state-of-the-art health care for the citizens at the apex level. These facilities enjoyed the cooperation of Osun government. The School of Nursing and Midwifery, College of Health Technology, and Osun State University were training institutions for health workers receiving the attention of the Ministry of Health. The Primary Healthcare Development Board oversaw all the primary health care centers run by the local government. Osun Health Insurance Scheme was a new addition to the Healthy Living Made Easy agenda of erstwhile Governor Aregbesola. It was a program designed to help policyholders to access health services at any facility of their choice in the state at heavily reduced cost, while the insurance managers picked up the difference at a premium paid or deducted monthly from the policyholder's salary in the state. The Honorable Commissioner for Health, Isamotu Rafiu, worked in collaboration with his colleague, the Special Advisor to the Governor on Health, to deliver the dividends of restored health services in the state of Osun in tandem with other stakeholders like the former Commissioner for Environment, Honorable Korede Idowu Michael. The environment encompassed every place on land, water, and in the air in Osun during Aregbe's time. The government did not joke with the issue of the environment.
Immediately this government came in, we declared emergency on the sanitation of the state. And to achieve this thing, we set up Clean as a concept to make us achieve clean environment.
Health is total. It is the totality of human relationship with self and environment. Immediately you get to Osun, you will see a change in the outlook of the environment. We plant trees, so you will see trees lining our highways. You will see a clean ambience of the highways. Check our roads, whether you have accumulation of sand at the median. These small things go a long way in eliminating opportunistic diseases and illnesses. So we are very strict on hygiene and sanitation.
Cleanliness of the environment and maintenance determined the level of wellness of the people. Therefore, on assumption of office, former Governor Aregbesola created the Clean program to sanitize the state, ridding it of accumulated solid waste that had become a problem to the health of the people. He provided facilities like refuse collection trucks to, in the first instance, clear the mountains of refuse in the environment and subsequently provide a waste management service through private operators assisted by government to service the communities at subsidized cost.
The government purchased 62 roll vehicle, and we gave all these vehicles to PSP, that is private sector participation operator, to operate the cleaning of the environment. We gave them clusters to collect, get money which we regulated, and to dispose of sanitarily.
Another point of interest was the radicalization of the environment for beauty, cleanliness, recreation, and development.
The objective of the ministry was basically to manage government land, government assets, get value for land, ensure that the physical space was not only harmonious and well planned, but to also have an urban development initiative that was second to none. And so the task was, how do you revamp these urban centers? How do you ensure that there's a multiplier effect as it relates to tourism and cultural protection and preservation? Osun is quite lucky in the sense that Osun is highly urbanized, and so it boasts of even 17 urban centers that can be well classified as cities. However, the initiative was targeted at 9 cities. And the Urban Renewal Initiative was actually quite successful. We've seen the development at the railway station, which is tagged the Nelson Mandela Freedom Park. It's about a 9-hectare facility that has brought not only a lovely landscape within the central business district of the capital. There's now a place for recreation, a place for taking walks. I think it commands thousands and thousands of revelers and visitors during the festive period.
We place serious premium on beautification in the state of Osun, and we have done a lot of things around this line. And by and large, we have been able to showcase is that aesthetic value of our environment is key to us, is key to good development. And that's why we are not playing down on it at all.
Maternal and children health care was a matter at the center of the programs of the Ministries of Health, Women and Children Affairs, and the Office of Her Excellency, the wife of the Governor. While the health system performed its statutory roles in delivering sound health care to pregnant women, mother and child, the Women Ministry took the matter further to the community level to educate and intervene appropriately on matters of women's health and child care, motherless children inclusive.
There's hardly any health center that you go, you now have about 3 or 4 deliveries per night, in a day. So that tells you that people go to our facilities to deliver, and we have equally done so many things to encourage them. I give you an example. Just in December 2017, when we flagged off our SMS Save 1 Million Lives program for research, we distributed mama kits to our people. Mama kit is what contains what pregnant women will need during delivery, and the mother as well. So we distributed that, about 15,000 of that we are distributed, and it's an ongoing thing. When people go to our health centers, they get that free of charge. The idea is that if you are poor and you cannot afford that, the tendency for you not to frequent TBAs, churches, and some herbal homes to deliver is high. But we have provided all that to them, and we are not relenting on our horse. We still want to procure more. Some drugs that pregnant mothers will require, misoprostol, something that will prevent postpartum hemorrhage. We have it, something that will take care of the baby's cord. We have it, the baby's pampers, and all that. Sanitary pad for the mothers. We provide for them free of charge. And of course, like I said, it's been free in our state. There's a strong indication for cesarean section. When mothers had Caesar section in our hospitals, it is done free of charge. So all these are what we do to encourage our mothers, to go to public health facilities to have their babies. Now, having said all that, we know that no matter how much you try, some of our mothers will still go to traditional birth attendants. If you provide the best facility, the best personnel, it is our culture. Yours sincerely was delivered by one of these TBAs. We know that our women will still go to that. So what we have done is to organize capacity building and community sensitization for traditional birth attendants, which we have done. Well, we will still do again before we finish our administration, because we believe that if our TBAs know their limit, that look, this there's complication here. There's no heroism in medicine. There's complications here. I cannot handle this delivery. It is better. We want them to recognize those signs, those red signs, red flags, so that they'll be able to refer our women to hospitals where such things will be better handled.
Another area of collaboration for the Women Ministry on Children's Health was feeding. Breastfeeding as prescribed by the authorities and school feeding for children called O-meal. O-meal was not just eating for feeding's sake, it was feeding for health's sake. Hence, the inputs of the Ministry of Women and Children Affairs and the nutrition experts from OAU Ileife and IITA Ibadan.
UNESCO, long before my advent, selected some 6 states, Osun inclusive, to pilot school feeding. Osun was one of the few that sustained it till my advent, but it was so badly managed and put together. The foods were cooked in the school compound that were very unhygienic. The appearances of the cooks and the vendors were distasteful. From the color of the uniform, which was shabby, unattractive, and usually dirty, to the preparation of the meal and the menu itself.
So the governor directed that we should seek the advice of nutritionists, which we did from Obafemi Awolowo University and the University of Osun. So we requested for a menu for the children that will impact on them positively, that will impact on their health, that will impact on their growth, because quite a lot of the students, especially in the rural areas, had stunted growth. We had to deal with this. And also, we sought for food that would develop them mentally and physically. This we got from the institution. Out of what they directed us to do was feeding the kids with food rich in protein: eggs, chicken, beef, and fish. This we adopted. We feed the kids twice a week with chicken. We feed them once a week with eggs, and they take fish and beef once each. In addition, they directed that we should ensure the kids take fruits daily and vegetables.
By the time we were done with all the reformations, we came up with Osun school feeding and health program, which involved good and well-formulated meals based on locally available food commodities, periodic deworming, because if you feed children and you do not deworm, you will be feeding the worm and not the children.
We sought the recruitment of food vendors. 3,007 women were recruited across the states from all the nooks and crannies of the state, irrespective of the political affiliation, religion, or anything.
We realized that they needed to have the knowledge of hygiene. They needed to know how to go about cooking. So what we did was we organized an intensive training exercise for them. It was spread over 1 week. In fact, it took place simultaneously in 2 different venues in the state at that time.
We were trained on how to maintain our hygiene aspect of the food, on how to cook our food. We are trained on how to cook the food to maintain the nutrients. And we normally do that training every year, including medical tests, so that if there's anything wrong with any food vendor, that person will be treated by the state government.
But our training is not a one and for all thing. We train our food vendors practically every year. In fact, anytime we are on holiday, we ensure we engage them. We have practical training sessions apart from the theory.
And to the glory of Almighty God, till date, we have not had any case of food poisoning or any of the students becoming ill after the consumption of the food. We've been accredited for this, even beyond Nigeria.
We traveled to UK to see what they were doing. We discovered what we are doing was better, and we have to tell them what we are doing, and they learn from us, because their children were eating junks. They discovered that, look, they have to change from what they were feeding their children and go back to what we are feeding our children.
Managing the environment of mosquitoes to forestall a malaria epidemic was a program vigorously pursued in Osun because Nigeria, being in the tropics, fell within the endemic zone of malaria. The vector for malaria is Plasmodium, an organism transmitted by the female Anopheles mosquito when it bites human beings.
When Mr. Governor came on board, the issue of Osun Youth Empowerment Scheme, OHIS, some of these OHIS cadets, we are trained as combatants for indoor residual spray. Basically they were given the task of spraying homes of people to reduce mosquitoes. If you are able to combat that, we'll be able to reduce the disease burden of malaria.
A campaign to sleep under treated net was also sponsored by the government of Osun. This was apart from the campaign ongoing then on rid the environment of mosquitoes and their breeding places. And
in conjunction with some partners, Catholic Relief Services, Global Fund, we got in 2013, we had about 1.7 million of insecticidal treated nets, which we are distributed to our people. And just last year, we had close to 3 million of insecticidal treated mosquito nets, which were treated to our people. Because we believe that, if you are not, the science, because we know the vector of malaria is a mosquito, Anopheles mosquito. If you are not bitten by mosquitoes, the chances of you getting malaria, will be reduced. So we try to reduce the population of mosquitoes. Then our environment, in conjunction with the Ministry of Environment, try to the breeding species of mosquitoes and all that. We try to clear our environment, enlighten our people to live a healthy life.
How did the non-governmental health facilities and service providers fare in Osun between 2010 and 2018?
We have a bill that is almost finished now, about monitoring and evaluation of our private hospitals. We want to sanitize issue of quackery in our state. We are a federation. We could do that on our own. That if you want to have a hospital in Osun, in our state, these are things that you must possess.
If the government saw them as part of the system, how were they assisted?
We do collaborate with private practitioners. We hold meetings with them. A few weeks back, when I had a conference to sensitize our people about the Lassa fever, we actually invited private practitioners to be part of the meeting because we give them PPE, strengthen them, things that they will need if people initially present to them before they get transferred to public hospitals.
Another major contributor to the good health system in Osun was the Office of Her Excellency, the wife of the governor. A special foundation called SCARF took care of women and vulnerable children in the society.
Diarrhea is a major child killer disease in developing countries. Consequently, intervention in sanitation remains a major determinator in the attainment of developmental aspirations in developing countries. And the only process for now that triggers communities in relation towards achieving sustainable environment and behavioral change is community-led sanitation. Here in the state of Osun, since we started the campaign against food regulation practice through the CLTS, I'm happy to report here that it is a program worthy of every effort and success in food. Our achievements under this campaign among others, getting about 107 communities to become open education free.
The Ministry of Social Engagement, Youth Sports and Special Needs coordinated Governor Aregbesola's Walk to Live program for 4 years around the state. The Keep Fit weekly exercise was done to encourage the people to engage in sports and stay healthy. It seriously encouraged the people of the grassroots areas in the state.
We encourage our people through mobilization to engage in physical exercises. I told you for 4 years without break, every month, I must engage the people in one form of physical exercise or the other. Some elites join us, but the majority of the people are so, even the others equally participate. We walk a minimum of 10 kilometers around the state.
Other areas touched on health included rehabilitation of the mentally challenged and the care of the senior citizens. These will be highlighted in our episode on security, peaceful coexistence, and communal living. Watch out. That's our program for today. Thanks for watching.